And then Dr. Meg Sullivan is here to talk to you specifically about our vaccine efforts, and then we'll be happy to answer questions from the media. So as you are probably aware, all of our metrics are beginning to increase. We're seeing increases in our case numbers. We're averaging 269 a day, increases in our percent positivity rate at 7.7% per day average, and then our hospital daily census is around 142. All of those are up over the past 14 days, so we are seeing some increases. I've been asked a lot of times about the reasons for that. There are probably a number of contributing factors. We know that we had some reopenings in late March into early April from the governor's executive order that allowed people to be out and about more, as well as engaged and involved with more people in different types of settings. We also know that we had Easter weekend, as well as the Easter holiday weekend, as well as spring break, that created opportunity for a good bit of traveling and for people being together in ways that they had not been before. And then lastly, we do know that we're seeing some increases of some of the variants in our community that have the potential for increased transmissibility. So when you put all of those things together, it's not surprising that we're seeing some increases in our metrics. We just have to watch those closely to make sure that they are not creating significant issues for us as we move forward. Which just reemphasizes the fact that we have got to continue to wear our masks and socially distance and avoid crowds. Those are things that we're going to have to continue to do moving forward. We need to reconcile that in our own heads and in our hearts as we move forward in making sure that we are doing what we can to protect our community. The good news is that we have not had any deaths in our long-term care facilities since the end of February. That is significant because at one point, our long-term care facilities were representing well over 50 to 60% of all deaths in the county. But as you know, they were all heavily vaccinated early on in the process, so late December into January and somewhat into February. Both the residents of those facilities and the staff had the opportunity to access vaccine as well. And what you see is sort of a microcosm of the situation where you've got some herd immunity going on and improvements in terms of even when people get infected, the illness is not as severe and the possibility of death has really drastically decreased in those settings. So we need to celebrate that, I do believe, and recognize that it just reinforces the need for us to be vaccinated in our community. So in terms of vaccine, we are seeing increased supply and increased access points. There's been a lot of concern about whether we've sort of reached a peak and whether there's so much hesitancy in our community that people are not going to be vaccinated. What we're seeing, I think, is to some extent a lack of urgency that we saw early on in the vaccination process. We still have people accessing vaccine. We just have to work at it a little bit harder. And we are looking and working with our other providers for vaccinations to try to make the vaccine as easily accessible as we can to those individuals that need to be vaccinated in our community. Right now, we are 34% partially vaccinated in Mecklenburg County and almost 22% fully vaccinated, which is great news, but not good enough. We've still got a long way to go. A couple of other quick updates. We are waiting to see when Pfizer is going to be approved for 12 to 15-year-olds, and we expect some news on J&J from the meeting that happens with the FDA and the ACIP on Friday. So those are things that we're continuing to work on. The last thing I'll mention too is that we are moving into efforts to do more canvassing and grassroots work in our community to help people become more comfortable with the vaccine, and as well as making it more readily available and accessible to individuals in the community. So hopefully you'll recognize more of that as we move forward as well. So now I'll move it to Dr. Sullivan for more of an update, specific update on our vaccines.
Thank you as always, Gibby, and good morning, everyone. So again, as a brief update for vaccines for Mecklenburg County Public Health, as of today, we have administered over 95,000 first and second doses of the vaccine at our fixed sites, at our community events, and through our homebound vaccination program. And we've transferred more than 40,000 doses to enrolled providers throughout the community. Just as a quick highlight, we held an event last weekend at Camp North End where we vaccinated over 1,100 individuals. And the event really was a huge success due to the incredible planning by our staff, collaboration with a numerous number of community partners, and just nonstop positive energy and excitement, providing or receiving vaccines by all involved throughout the entire day. And I think that team effort was just a great example of the ongoing efforts to vaccinate our community as quickly and equitably as possible. As Gibby mentioned, we currently have a large supply of COVID vaccine available in the community, including both appointment-based and walk-in access at multiple facilities throughout the county. It's really good news, and given the significant vaccine availability and capacity at our current fixed sites through our numerous enrolled providers, public health going forward is really going to double down on our focus on our efforts on more coordination across providers and connecting with those that are hardest to reach populations. So we announced yesterday that we will stop providing schedule appointments at Bojangles at the end of April. We did open our last round of appointments at starmed.care this morning for first doses through April 30th. Those appointments can also be accessed through our hotline, 980-314-9400. And we still will be offering walk-in first dose appointments and all second dose appointments for those who received their first doses through April 30th at Bojangles through May 20th. And we're really proud of the efforts, number of vaccines, and impact that Bojangles has had as part of the vaccine response, but are also confident that there's now sufficient access at our larger fixed clinical sites in the county. And again, public health efforts can focus even more now on targeted vaccination and outreach in the community. We still have our Medic site on Wilkinson Boulevard open on Monday, Wednesdays, and Fridays, and some Saturdays for both appointment-based and walk-in vaccines. We also continue to closely collaborate with StarMed, with Novant, with Atrium, and other enrolled providers to ensure sufficient ongoing vaccine availability at other sites. And we are currently also conducting direct outreach to potential vaccine providers who have not yet enrolled to be able to provide COVID vaccine yet in order to engage even more providers throughout the county. And just a couple other quick announcements. In accordance with our vaccine equity plan, we have been working to update our COVID-19 website to reflect available vaccine opportunities, and our hotline staff continue to assist residents with appointment and walk-in opportunities throughout the county. We also continue to host multiple community-based clinics at locations throughout the county, which includes this week partnership with the LGBTQ Chamber of Commerce tomorrow, the Calvary Christian Church, and the Holy Trinity Ethiopian Orthodox Church on Saturday, and another event at the Southview Recreation Center next Monday. And all of these events will offer both appointments and walk-in. And then finally, as Gibby said, in addition, part of our ongoing efforts to reach individuals who have not yet been vaccinated, we are expanding the COVID ambassadors' role in vaccine outreach, launching a partnership with Action NC for grassroots canvassing and door knocking, and increasing our efforts to partner with community-based organizations, home health agencies, and providers to identify and reach homebound individuals